The Republic of India has a population of 1.24 billion. Of these, 100,000 suffer from leprosy. The risk of social rejection is so great that many people cured of leprosy end up in isolated settlements. There are over 1,000 leper colonies in India, whom of which survive off a meager government pension, which many supplement with weaving, but mainly their occupation is begging. From the political aspect, India is a union government that has a population of 1.237 billion. It is the world's most populous democracy. 29.8% of the population live below the poverty line. India ranks third in the world for people living with HIV. On average, the life expectancy is 68 years for women and 63 for men. 4.1% of India's GDP is used in health expenditures. 66% of the population live in unsanitary places that have not been improved, which leads to water contact diseases such as leptospirosis. Leprosy destroys your nerves. Sensory nerves, which control feeling, motor nerves, which control movement, automatic nerves, which control glands and secretions. With no feeling, you can hurt or cut yourself, and with no movement or sensation, parts of your body become dry, which makes skin easier to crack, allowing infections to set in, which is usually painful. When meeting people with leprosy in India, they are found living on the tracks. They have been secluded from the city and are forced to become outcasts with the disease. The leper colonies are found across the tracks. Several drugs are used in combination in multi-drug therapy, also known as MDT. Dapsone was the mainstay treatment for leprosy until a wide spread of resistant strains appeared. Rifampicin was then combined with dapsone to treat possibly leprosy. Clofazimine is another drug used in multi-drug therapy, in combination with rifampicin and dapsone in order to treat multibacillary leprosy. Ofloxacin is given in combination with rifampicin and minocycline as a single dose to cure single lesion paucibacillary leprosy. Dapsone acts against bacteria and protozoa, that is by inhibiting the synthesis of dihydrofolic acid through competition with para-aminobenzoate for the active site of dihydropyrotic synthase. Clofazimine binds to guanine bases of bacterial DNA, thereby blocking the template function of the DNA and inhibiting bacterial proliferation. It increases levels of cellular phospholipase, leading to release the accumulation of lysophospholipids, which are toxic and inhibit bacterial proliferation. Side effects include discoloration of the skin upon sun exposure, and it causes skin dryness and ichthyosis. Ofloxacin works by inhibiting DNA gyrase, a type 2 topoisomerase, and topoisomerase, which is an enzyme necessary to separate replicated DNA, thereby inhibiting bacterial cell division. Leprosy can manifest as a simple tingling sensation to complex and tragic motor paralysis. Pure neural leprosy affects only the nerves without the skin lesions. It involves the ulnar, median, lateral of the popliteal. Up to 30% of patients with the pure neural leprosy develop hypopigmented patches. Paucibacillary leprosy is also associated with tuberculoid leprosy. It is characterized by hypopigmented areas of the skin which have lost feeling. Due to its association with tuberculoid leprosy, it is possible that paucibacillary leprosy is not contagious. Multibacillary leprosy is characterized by lesions on the skin, nodules, thickened skin, and damage to the nasal passages. Serious multibacillary leprosy can lead to the loss of limbs. The loss of feeling prevents the adequate care of cuts or burns on extremities, which may lead to gangrenous infections and eventual amputation. Serious leprosy of the nasal passages can cause loss of the nose or the eye, and in some severe cases, infection may cause reduced output of testosterone from the testes, causing impotence and infertility in men. Residential homes at Bankura Hospital provides health care for 42 elderly patients, whom of which are severely disabled by leprosy. The Brighter Future Development Trust works in partnership with the government by helping provide housing to 31 families affected by leprosy, in doing so, providing and forming leper colonies. This presentation was given to you by Sienna Baptiste, Valdosta State University, Medicinal Chemistry.